Hi folks, this is Arvind Kanchi from the social media team. I've got Vivek Goel with me and we're looking at today's workshops at the ISNCon 2023 in Calcutta. Vivek, let me know what sort of salient points did you pick out of these workshops today?
So the first workshop based on the genetics and nephrology I found really interesting. That is the clinical application as to which test to apply in which clinical disease. That was pretty interesting. Then I really found the CRRT workshop as to when and how to use the combination of CRRT and ECMO patients. So that was pretty interesting, I guess.
Excellent, thanks Vivek. I'm going to move to Sai Wani. Sai, what did you find were the salient points that you picked out of these workshops that we had? They were pretty brilliant workshops today.
Yes,
what do you feel?
During interventional nephrologists, I have learned two things. One is reimplantation of peritoneal dialysis catheter by Dr. Vineet sir, and another
Vineet Behra, you mean?
Yes.
He's here. There you are. Okay, we'll ask him
Yes,
what were his points. Okay, go on then.
Another thing is in perm cath insertions, even if you have thrombus in internal jugular vein, you can go about it. And another thing is reinsertion of perm cath through guide wire is better than removing the catheter completely, even in case of sepsis.
Excellent. Thanks, Sai. And moving to Varun here. Varun is also here with us, part of the social media team. Varun, what did you pick out of these workshops today?
First thing I would like to say, I love the sweets. Bengali sweets are awesome here. Very,
Excellent.
very beautiful. Then coming to the academics per se, the first scientific workshop, scientific writing workshop, the main thing which everyone taught us about the imposter syndrome. First and foremost, don't get scared. Keep trying and you will get the funds, you will get the research. So that never give up on that. Many people have failed, but again they have succeeded. So never give up on that. Second thing, two important devices which I learned in intervention nephrology. One thing about the surfacer, where you have, if you have an internal jugular vein stenosis, where you can approach from the femoral vein, come up to the IJV and do an inside-out catheter rather than outside-in. That's something new. And one more is a bioabsorbable graft, where you connect the artery to vein, which gets absorbed on its own with a vascular artery forming on itself. So it's an absorbable graft, which I never heard of. Sounds beautiful. And one thing about technique was, which Balasubramaniam sir told, was about the end-to-side anastomosis of IV fistula rather than end-to-end, side-to-side. Yeah, side-to-side anastomosis rather than an end-to-side anastomosis. That is one thing which is very useful practically.
Excellent. Thanks, Varun. I'm going to drag Vineet here. And Vineet actually gave us a very good talk, out of which I picked up some points on PD cath insertion and urgent start PD. What was your talk about, Vineet?
So I spoke on malposition and leaks, how to manage that. I spoke on the common techniques and what are the causes of malposition, how it can happen. And I spoke on the various methods, that is the conservative methods, the percutaneous manipulation and repositioning of the PD catheter. I shared a video and discussed the other methods. And of course, PD leaks, how to manage that, we all discussed that.
And you feel that, when you reposition these cats, the PD cats, you can do an urgent start almost immediately. That's what you said.
Yeah. So if a patient is on PD and he is in malposition, after manipulating or repositioning, PD can be started immediately after the insertion or the repositioning of the catheter.
Right. I'm going to give a few words myself. So I was looking at what Dr. Dori Segal said about artificial intelligence in transplantation. That was very good, a very nice talk where he brought up important points on how you could actually speak to the live donor and categorize the risks of his or her donation, and how therefore you could actually counsel that particular donor on what would be his or her risks after donating a kidney. That was very important. Bringing artificial intelligence into cadaveric transplantation as well. He pointed out how you could harvest from more donors, how you could actually get more kidneys, those marginal donors, and how you could allot those kidneys and how you could transplant those kidneys into patients. That was something quite extraordinary.
Okay, so I was actually making a tweet also about that. It was a very good link. The first positive HIV positive transplant. When do I start?
You start right now. In fact, you're on camera. So I'm looking at what Sayali has to say about the conference. We had a good session of workshops today. Sayali, what were your takeaway points from these workshops?
So the conference has started out very strongly today. We had the first session on genetics and the other workshops, and I thoroughly enjoyed everything. I have a fascinating point to tell you all about Dr. Dori Segev's talk, which was on big data and artificial intelligence. So the strength of having such an analysis in place can actually work wonders. And one example that he came up with was the first HIV to HIV positive transplant in the United States, based on 3 studies which he showed us over a span of 2014 to 2017. And in 2019, that resulted in the first HIV positive transplant. So it's very, it actually moved policy and it benefited a huge number of patients, both positive and even those not positive. They benefited because the waiting list becomes less, even if the patients are not HIV positive. So huge learning points. Yes, looking forward towards more tomorrow.
Excellent.
That's all.
Thanks, Sally. And let me get Jitu into the picture. Jitu, if you can walk into this side. Yes, there you are. And Jitu, what did you learn from these workshops?
Yeah, I
today?
think the workshop today, the most attractive workshop today I felt was the genetics workshop, and this was led by Dr. Satish Balan and team. And I think the most attractive lecture among the one was by Dr. Susan Udup, in which she spoke about tubulopathy, genetics and tubulopathy, the Sherlock Holmes version, in which you had different pattern recognitions of hyperchloremia, hypokalemia, metabolic acidosis, alkalosis, hypervolemia, and how to define a disease based on these patterns and then come to the diagnosis. Second was the talk by Dr. Satish on genetics in renal transplantations, how we can pick up the mild genetic diseases in the donor and further prevent them from going to ESRD, how to analyze the genetic reports. And I think the whole consensus was that we as nephrologists should be trained from the very beginning about how to send, when to send, and when you have sent a report, how to analyze the report. So I think genetics is going to come in a big way, and ISNCon 2023 has a great start with the genetics workshop, which is probably going to get bigger in the coming years and coming people to come. Thank you so much.
Excellent. Thanks, Jitu. I just want to zoom in on this rather nifty pin that you have there. And this is the social media pin that the whole team gets. Thanks, Jitu.
Thank you.